Fiona. Good morning, everyone. Last night we announced that as of midnight, Perth and Peel will be entering a 4-day lockdown. This full lockdown is designed to act as a circuit breaker, to buy our contact tracers and testing systems time to gain a truer picture of how far this outbreak has spread. We received confirmation last night that we are indeed dealing with the Delta variant of COVID-19. The evidence of the transmission between the 3 cases known yesterday was highly concerning, as was the magnitude above what we have seen in prior outbreaks. We didn't want to risk the virus getting out of control. We want to crush this outbreak as quickly as possible. We do not want this deadly virus to linger undetected in the community. We want to be able to quickly and safely lift restrictions and get ourselves back to the quality of life we all enjoy, lifting the burden off businesses and the community. That means the best, most logical option was a quick circuit-breaking lockdown. I acknowledge that lockdowns are disruptive and burdensome for many, and I'd like to say thank you to West Australians for doing the right thing both yesterday and today. Thank you for adhering to the restrictions and wearing your masks. I'd also like to say a big thank you to all of our essential workers, our health professionals, our contact tracing teams, our teachers and education staff, our emergency services staff, our supermarket, logistics staff and others. And of course, to our West Australian Police. A full list of who is designated an essential worker is up on the WA Government website. Just with regards to the West Australian Police, police have done an exemplary job setting up the checkpoints to enforce the boundaries between the Perth and Peel regions and the rest of the state at such short notice. 8 checkpoints have been established. Overnight, police stopped 555 vehicles, and of those, 38 were turned around. I can also advise that nearly 10,000 calls were taken on the 13 COVID hotline. I'd also like to say thanks to everyone that's involved with that operation, providing essential information to the community. Our contact tracing teams in health have scaled up, also supported by WA Police. We've recalled 120 police recruits from training to help over the lockdown period to assist with various policing duties. Lockdowns aren't easy. They take a lot of work from government, business and the community, and just to repeat, everyone has my thanks for doing the right thing so quickly. Last night we announced case 1024, the man in his 30s who had a meal at the Indian Ocean Brewing Company in Mindarie. Overnight, there have been no new cases of COVID-19 detected. Just to repeat, since the case announced last night, there have been 0 new cases of COVID-19 in WA today until 11 a.m. This is very encouraging news, but we have a long way to go. 14,771 tests were conducted yesterday, a fantastic number, and we want to see more today. Testing is so important to not only finding the virus in the community, but giving us and the health officials the confidence to safely ease restrictions when the time comes. I understand the wait is frustrating, but I recommend checking the full list of testing locations online. With regards to close and casual contacts of the 3 positive cases, I can advise that as of 9 p.m. last night, 209 close contacts have been identified and contacted. 109 have returned a negative test result so far. With regards to casual contacts, 1,828 have been identified and 275 have so far returned negative test results. I should advise, however, we expect the numbers of close and casual contacts to continue to rise as more are identified and additional exposure locations are added, especially given case 1024 was only confirmed last night. I would like to remind all Western Australians to keep checking exposure locations online, as they are regularly updated, as well as the importance of checking in on the Safe WA app whenever you go to a retail or other outlet. This is an incredibly concerning time around the nation at the moment. We've seen concerning numbers in New South Wales and the announcement of a lockdown in southeast Queensland. Not since the early days of the pandemic last year has so much of the country been subject to restrictions. I can advise that based on health advice, as of 3 p.m. this afternoon, the hard border will return with Queensland. This means they will be reclassified as a medium risk jurisdiction under WA's controlled border. Like New South Wales, travellers from Queensland will require an exemption to come to WA and self-quarantine at a suitable premise for 14 days and be tested. Returning West Australians are classified as exempt travellers under compassionate grounds who will need to complete 14 days of self-quarantine and appropriate COVID testing. These are challenging days for the country. The Delta variant is testing our systems and our community like never before. I have faith, however, that we will crush this outbreak, save lives and jobs, and get things back to normal very quickly. But like I said yesterday, lockdowns and restrictions are not a long-term solution. Vaccination is. We need every Western Australian to get vaccinated when it's their turn. And I note that getting vaccinated is a legitimate reason to leave your home. Please keep your appointment. Vaccination is our way out of this. Just finally, I'd also like to make a further appeal to the West Australian community. Red Cross's blood donation centres still need donations. It's important to remember blood donor centres are still open. And blood and plasma donation is one of the reasons you're allowed to leave the home. If you're healthy, please consider donating. And if you have an appointment already, do not cancel it. Please keep it. Just because we're in lockdown, it doesn't mean the need for blood goes away. To book your donation, visit lifeblood.com.au. Lockdowns can be frustrating. It often goes against our nature to sit at home and feel like you're not doing something. One of the best ways to fight that feeling and do something that feels tangible is to donate blood. I'll now hand over to the Health Minister.
Thank you, Premier, and good morning, everyone. The next few days will be crucial for Perth and WA. If we can stop this outbreak in its tracks, we will get back to our normal way of life sooner rather than later. To do this, we are once again calling on the community to do their bit. Practice good personal hygiene. Wear a mask. You are required to wear a mask outside the home, at all indoor settings, on public transport and outdoors at all times unless for vigorous exercise. Anyone who has travelled outside of Perth metropolitan area and Peel region since Sunday must continue to wear face masks when in public. If you are feeling unwell or if you have been at an exposure site, get tested and quarantine. If you do leave home for essentials, use the Safe WA app or check in using the contact registers. Yesterday, we had 1,677,397 scans. This is a fantastic result and helps our contact tracing team enormously. Can I also reinforce just how important it is to get vaccinated? If you have a booking, you can still get vaccinated during lockdown. If you haven't made a booking yet to be vaccinated, please visit Roll Up WA or phone 13 COVID. The changes that were approved by the National Cabinet last night mean that everyone over the age of 18 can be considered eligible for vaccination. I've had my first AstraZeneca jab a few weeks ago and will be getting my second in the coming weeks. Yesterday, WA Health delivered 4,731 doses, 3,740 first and 991 second doses. In total, there were 5,660 vaccinations yesterday, 4,045 first jabs and 1,615 second jabs. Our amazing team of contact tracers is working hard to determine exposure sites, and the Chief Health Officer is closely monitoring the information as it comes to hand. Can I just say, in relation to case 102, in response to questions regarding that case's vaccination status, I can confirm that case 1022 had been vaccinated 12 weeks before the transmission of the disease. Her husband 10 weeks before the exposure. Now, international studies show that AstraZeneca provides immunity of around about 30% after the first dose in relation to the Delta strain. So clearly it is important that if you've had your first dose of the AstraZeneca vaccine, please continue with your program to get your second dose. I'd like to thank the community once again for following the advice and doing their bit. We've been through this before together, and together we'll get through it again. I now hand you over to the Health Minister, to the Education Minister.
No, thank you. Good morning. I'll make a few comments and I'll hand back to the Premier for general questions, and I'll be available for specific questions after that. So education matters. Every day at school counts and every day missed counts. This year started already 1 week down academically. As you will recall, we extended the school holidays at the start of term 1. Education is an essential service and those who provide it are essential workers. I'd like to thank all of the school staff for the work that they do every day, and in these trying times particularly for their flexibility and their resilience to rapidly change. Applying the public health advice to schools has been from the beginning about balancing the clinical, the economic and the social elements. The clinical, that's the health risk. The economic is the need for people to work and earn money, and that's compromised if they have to be at home, if their children cannot attend school. And the social is that education matters, and indeed for some children, school is also the safest place to be. So we keep schools open and we put in place additional protective measures. Masks, extra cleaning, no external visitors unless for essential business, no large events at school. When we need to do more at specific school sites, we do, and we have in the last week. So where we had some staff who were at Yaluma Primary School in Girraween who had attended an exposure site, they test, they stay at home till they get a negative result, and we replace those staff at that school. If a school has had a close contact, which 3 schools did, we closed the school for a deep clean. This is at Kandoola, Connolly and Burbidge. Those students and staff test and stay at home for 14 days, and the school is closed until the test results and the contact tracing is complete. The Chief Health Officer will direct a deep clean and a closure of school where it is required. We've done that in 3 schools already, and we won't hesitate to do it again. I'll hand back to the Premier and then I'll take questions specifically after that.
Thanks very much, everyone. Any questions?
Premier, are there any further details about how case 1023 and 1024 became infected? Was it in direct contact with 1022? Do you have any other update?
So 1023 acquired it at the gym. I don't have exact details as to how she acquired it at the gym, but certainly our contact tracers are working on that. And 1024 acquired it at the Indian Ocean Brewery. The advice I have was that he was on a different table. We haven't reviewed any CCTV as yet. That is a process that is currently underway to see if there was any interaction or how close the interaction was. But the assumption is that Delta is very transmissible, and therefore a fleeting contact can result in transmission.
Are you looking at an assistance package for businesses, Premier, at this early stage? Those businesses that have had to close up? I mean, I noticed New South Wales has announced something today.
I've asked Treasury to work on that last night and make sure that we can support particular small businesses that have suffered here. Obviously, it's very regrettable and very sad that some businesses will suffer over the next 4 days at least. I went to a cafe this morning to get a takeaway coffee. All the chairs and tables were stacked up. It's normally a bustling cafe. It's very sad to see that occur. So we're working on what the assistance package we can put in place will be, and no doubt we'll have further announcements over the course of the next week or so.
Do you have an amount in mind?
No, we don't.
Can West Australian businesses expect something similar to the New South Wales package?
I don't know what theirs is.
I think it's 10,000.
Between $5,000 and $10,000.
Yeah, well, they've had a 3-week lockdown, and I expect it will go further. So obviously, we don't expect we'll be in that position. We'll work out exactly what it is in the future. The last time we had to do this, we made it a $2,000 payment, which was consistent with what Melbourne and other states had done before, but we'll work out exact details over the coming days.
Would you consider including regional businesses this time, which will be impacted by travel restrictions?
We'll work out what we can do over coming days.
And AstraZeneca for under 60s, do you advocate that?
Look, this was, I think, under 60s is what they announced. Yeah. Just trying to remember the exact details of what the Prime Minister announced. It was under.
It was AstraZeneca for anyone who wanted it.
Yeah, that's it. Yeah, that's it.
Was that actually discussed at National Cabinet?
No, we're advised. We're advised. The Prime Minister advised. The Commonwealth has done that. What they've done is offer a indemnity for GPs who issue AZ to those people in the younger categories. So that's a Commonwealth decision. And we're advised that that's a Commonwealth decision. The point I make, and I make it regularly, is that we have hesitancy in people over the age of 60. We have hesitancy. And I think we now need to, as quickly as we possibly can, move towards Pfizer being available to people over the age of 60. When you're over 60, you're in a more vulnerable age category. If we have community spread of the virus, people over 60 and 70 and 80 are more vulnerable to illness and death, and we've got to get those people vaccinated as quickly as possible. Now, I don't control the rollout of Pfizer. I don't control it. But I urge the Commonwealth to, as quickly as possible, make Pfizer available to people over 60, and in particular those older age brackets above that.
So just for clarity, the Prime Minister made a unilateral decision, but then went out and said that it was a matter of discussion between the Premiers, and it wasn't.
I can't get into what was said at the meeting, but I didn't know he'd said that. But the Commonwealth makes these decisions, and we're advised.
Should 40-year-olds, should over 60s be prioritised for Pfizer rather than 40-year-olds? Should those doses?
As soon as possible. You know, I've made this point a few times. We're going to get there anyway. We're going to get to that point anyway. There's hesitancy at the moment. Our clinics are issuing very few first doses of AZ for people in that age bracket. Anyone above 50 who is awaiting a second dose, I'd absolutely urge anyone above 50 awaiting a second dose of AZ to get their second dose as soon as they can. I certainly will be. The second dose has extremely low risk attached to it, but for those people above this age group of 60, who have not had their first dose of AZ, I just urge the Commonwealth to move towards Pfizer as quickly as we can.
What was the reasons as to why the partners of these cases have not contracted the virus yet, when someone sitting at a table in a pub has authorities?
Because the virus is a mystery. It's a mystery. And why someone who sits in a car, sleeps in a bed, shares a house with someone else, doesn't acquire it, whereas someone you walk past in a cafe does, is mysterious, and I don't have the answer to that. I'm advised that in the case of the lady 1022, that her husband had received his first dose of AZ, but why he hasn't acquired it is a complete mystery.
When it comes to the testing, so when it comes to the COVID testing, some have waited till 9:40 last night, and they have been turned away, and there's still another 60 cars waiting. Is it acceptable?
We're running testing clinics very, very hard, and we did as a state nearly 15,000 tests yesterday. We've opened up new testing clinics. We're obviously doing our best in difficult circumstances. Inevitably, what happens with COVID is these cases just come out of nowhere, and you have to ramp up quickly, which is what we're doing. So I just appreciate people are patient, they're understanding. At times it's going to be difficult, and we're sorry that's occurring, but that has been the experience around Australia and around the world with testing over a long period of time.
To what extent of removing the 2 square metre rule last week may have had on
transmission? Do you think that may have
Oh,
any effect?
no.
Can we expect any more exposure sites today linked to the man who was diagnosed overnight? There was just 2, I think, so far listed on the website.
Yeah, I think I said in my statement that we expect exposure sites to grow. So what happens is when you have a positive case, you sit down with that person, our health officials sit down with that person and interrogate everywhere they've been. And if you think about yourself, where you might have been in the last 10 days or so, hard to remember. Every single place you stopped, every single ATM you went to, every single service station you stopped at, every single person you spoke to. It's hard to remember. So there's an interrogation process that's gone through, and exposure sites are identified and declared over time as we tease them out of the individuals involved.
Just back on National Cabinet.
Only 275 of the 1,828 contacts returned test results. Are those test results priority? That they seem to be going quite slowly.
Have returned negative test results. Others are still being assessed. So what happens is, I don't control pathology, but they do them as quickly as they possibly can. Obviously, we want results as quickly as we possibly can, but there's certain processes that our pathology people go through in order to make sure it's accurate and delivered as quickly as possible. That's currently happening.
Have you made contact with the 3 miners that you mentioned yesterday that you hadn't reached out to from Granite's?
No, what I said last night was there was a number of miners that had left the state, and so they're in other states or overseas. I don't know where they've gone, but in terms of the miners, I outlined the figures before as to how many had come in. We're basically testing all of those ones who came in as quickly as we possibly can. We've had negative test results back on all of them thus far that we've received results on, and that's nearly the total number.
What's the value of
Sorry, Jeff?
What's the value of National Cabinet, having National Cabinet? If the Prime Minister's going to go and make a unilateral decision that affects the entire country and not having discussed it at National Cabinet?
Well, National Cabinet's been very effective, and I think it's been a great innovation over the course of the last 18 months, allows state and Commonwealth to work together effectively. Obviously, not everything is decided by National Cabinet. Sometimes the Commonwealth will make decisions, sometimes we'll make decisions. For instance, what I just said about Pfizer obviously isn't agreed by other levels of government, but that's just my view that I'm expressing. So, you're not going to have complete uniformity in everything you do, and sometimes different levels of government will do different things. The Commonwealth's advised us what they've done in respect to AZ. That was their decision.
Can I just clarify, you did say yesterday that there were 3 miners that hadn't been contacted. Have you contacted them all now?
So maybe Roger Cook will have the answer to that.
The directions published last night referred to circumstances lockdown level 3. So presumably there is a level 2 and a level 1.
That's right.
Are those sort of stage transitions out of lockdown already decided? Can you share details of what level 2 might look like?
Well, what we did the other day, I think it was on Sunday, we went to what was called level 1. And so that was masks, it was gathering limits, it was, we put in place the 4 square metre rule, I think. Obviously these things move, so that was level 1. Level 2 is an intermediate set of arrangements between that and where we are now. So obviously we have to pick and choose what measures are appropriate for the circumstances that exist. So we've gone to what's termed level 3, which is basically what would be broadly termed a lockdown, and we're doing it for 4 days. If we went to milder measures, it may well be that the measures were in place for a longer period of time, as opposed to the stricter measure that we put in place.
Is it likely that we would go from level 3 to level 2?
We haven't made that decision, but I suspect, and this has been the case the whole way along this road, is that you sort of transition down. So you don't necessarily take off all restrictions immediately, you transition down. So it may well be that on Friday, and I don't know yet because we don't know the testing results, that we transition down and we don't remove every restriction immediately.
Have we stopped international arrivals during lockdown? And Dan Andrews has said he would like to see the number of international arrivals reduced 75% or half capacity until we get 70 to 80% of the population vaccinated? What do you think about?
We haven't scaled down our international arrivals at this point in time, as far as I'm aware, but just to refresh your memories, about 6 weeks ago, we wrote to the Commonwealth advising we could take 530 per week. Before that, we were at 1,025. So in effect, we halved our intake already. That was in order to better manage our hotel quarantine system. I actually think Premier Andrews is right. We do need to have a national conversation about this and about how many we can take as a country. This is, hotel quarantine is a significant risk, and lockdowns are a terrible consequence. At the same time, we have people overseas. This has been the ongoing battle, the ongoing management issue that we've had to deal with over the course of the last 18 months. But I don't want to go through any more leaks out of hotel quarantine. That's why we basically halved our numbers 6 or 7 weeks ago. If we have to go further down, well then that's what we would do. At this point in time, I haven't had any advice that we need to do that yet.
What percentage of the national population do you think needs to be vaccinated that would stop a need for lockdowns to happen?
Oh, well, that's based on medical advice, but broadly speaking, we'll need to get to more than 80% before we are a safe community, but I think it'd have to be above that. The problem, I'll just explain it just generally. The death rate internationally is around 3%, and then there's people who acquire it, and then there's a group of people who get seriously ill and have debilitating consequences that can impact them for the rest of their lives. If you think about 80% vaccination, that still leaves 20% of Australians unvaccinated. That's 5 million people. And that 5 million people, if they acquire COVID, that's 3% of that. So they could potentially die. So that's just a large number of people. So I just want to see as many Australians get vaccinated as quickly as possible, way above 80% hopefully, so that we can come out of all of this very safely, very securely, and a very healthy way, and we can, over time, reopen international borders, we can move away from lockdowns, we can make sure that we are a healthy, safe, secure, and caring community at the end of it.
Has there been any progress on the purpose-built quarantine facility at Perth Airport?
Well, we're working on it. Obviously, I wrote back to the Commonwealth. I think the Prime Minister wrote to me on Friday, wasn't it? What's today? Tuesday? We wrote back to the Prime Minister on Monday or Sunday to say that we would be part of the assessment process, the formal assessment process they put to us. And I've asked our officials to make sure that we work effectively with them. But essentially, it's up to the Commonwealth now to build it. They've offered, it's on their land, it's up to them to build.